If you have a medical emergency, I think we all know that you have to call 999. And by medical emergency, I mean literally if there's a threat to life or limb. Anything less than that, so it can be quite a pressing concern, an urgent worry, anything medically related, you can call 111. So that's literally 111 on your telephone keypad. You can access the NHS 111 service online or through the NHS app. Incidentally, if you live in Scotland, that's NHS 24, but you would still access them by dialing 111 on your telephone keypad. It's a service that's available 24 hours a day, 365 days a year. Initially designed particularly if you are unable to get hold of your GP or your pharmacist or your dentist. And of course, you can call them at any time. It's not that easy sometimes to get hold of those services, even if they are officially available. The service is manned by trained advisors. They get a good thorough training, and they will take you through a prepared script, if you like, that's very carefully put together. It's very safely designed so that they are able to identify areas of risk or concern and ultimately to prioritise. The things they will want to know initially would be clearly your name, where you're calling from, what your concern is. It would also be important to tell them if you were actually ringing on behalf of someone else. You might have a worry about another member of your family or someone else. The trained advisor might be able to help you right from the start to the finish of that particular journey by giving you suitable advice as to how to manage whatever it is you're worried about. But they might also be able to help you to access more suitable services, tell you where your local pharmacy is, your local urgent care centre. They are also able to help you, by the way, if you have concerns about your mental health. Once they've taken you through that script and understood exactly what your problems are, what the risks are, what the priorities are, it might be necessary or appropriate for them to arrange for a clinician to call you back, a doctor or perhaps a nurse, and they will give you an idea of how long that's likely to be. They do try to get back to you as quickly as possible. It could literally be a matter of minutes, but it could, on some occasions and in certain circumstances, be quite a bit longer. So it's worth bearing that in mind. You might find that you've run out of a certain medication that you're on, and it's not something that you should be stopping, or that where there should be a gap in what you're taking. The 111 service should be able to help you with that. Once you've spoken to a clinician, they should be able to organise a small supply of what you need until you can get back in touch with your GP or your prescriber. And with that in mind, if that's a possibility, then it's worth doing your homework to make sure you can tell them where you would like that prescription sent. So again, look to see where your nearest pharmacist is that's actually open at the time that you're having this conversation. If you generally have to pay prescription charges, you would still have to pay for that. But if otherwise you're normally exempt, then the same would apply.